Thank you, Dr. Swapnali and Sahani sir. Good evening, good afternoon, and good morning. This is the 1887th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SADAT SAIT. Let us begin the session with 1 minute silent prayer. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have the local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends as well as family. Whether it be a homeopathic lover or a doctor or a student, it doesn't matter much. What matters is to promote homeopathy. This is the purpose of our program. And let me come to today's guest. It is none other than Dr. SADAT SAIT. He is having 2 clinics. One is at Cochin, that says homeopathy. He is the chief physician there at Cochin, and the other one is on Aluva. Both are in Ernakulam district, Kerala. And he is having excellent practice for the last more than 28 years, and he is one of the leading professional who is doing an excellent service to homeopathy by taking a lot of awareness classes as well as the seminars, and he is one of the most wanted faculty for Institution for Homeopathy Kerala as well as good homeopathic doctors of private practitioners, that is QFA. So he was former General Secretary as well of IHK as well as Secretary of QFA also. And Doctor has presented so many brilliant sessions in all our forums, that is in Hindi, English, and in our Malayalam. That is the specialty of Dr. SADAT SAIT. And today, Doctor is coming up with the homeopathic management of dermatological disorders. This is the third part of the same subject. So you can imagine how much importance he is giving to that subject. So we proudly welcome the guest of the day, Dr. SADAT SAIT, to the session, and we can begin the session, Doctor. Please unmute your co-host.
Thank you, IFPH. Can you hear me?
Yes.
Okay. Thank you, IFPH and Dr. Danesh for the valuable, lovely presentations of lovely introduction. Let me start this session with sharing one of the beautiful cases. I would like to
Yes.
Can you see?
Yes, yes. Visible.
This is one of the beautiful cases which happened last month. Okay, it is a case of this one 15 days treatment. This was when she came to me, and this is the result in 15 days. Only with homeopathic medicines. Medicine was given was calendula, echinacea, then streptococcin, gunpowder. Okay, gunpowder and gunpowder and silesia. These are the 4 medicines because I had to give it because there was no other patient is very far and she is not able to come frequently. So this medicine was given, the photo was taken later, and this is the result after 15 days of medicine. 15 or less than 20 days. I had given you all the other cases before. But this case I couldn't present it because this was one of the toughest case I also seen. Such a depth inside and see this in 15 to 20 days. And homeopathy can do anything. It's not difficult. You have to be a little confident enough to take such cases, give medicines, and save the patient. The patient is this is a diabetic ulcer also. Okay. So the photos tells you everything. I don't have to keep explaining what is it. So medicine is important. Echinacea, you have to give it internally. Echinacea tincture has to be used as internally, as well as you can do an external dressing also. Because when there is a pus, more the echinacea is used. When there is a granulation of the ulcers, use calendula. Echinacea you can give it internally to prevent the septicemia. You will not get much because the diabetic ulcer, you don't know what exactly it is. A patient doesn't have a pain also. Ulcer goes in depth also. Carbuncle also. Gunpowder is one of the beautiful medicines you can think about. Arsenical, carbovage, gunpowder, silesia, and syphilitic ulcer punched out depth. You see the depth in the first this one. Ulcer with depth and punched out. You can think about syphilis. Okay. So rest of the cases I think I've shown you last time. This is also again. I don't want to repeat it again. Last time we saw this. There's gangrene. I think I've told you in the English session only. And this is the gangrene. You see the result. Okay. So I'm stopping this. I'm just stopping this. Can you see me? Can you see this slides?
Yes, sir.
Okay. See, instead of going for a big things, we have to just stick to the simple things which comes to the clinic first. You can go into the lot of things, but handling a simple and common things become very difficult. That's the first thing. Okay. So let's start with acne rosacea, which comes to your clinic very often. At least 10 now, at least 6 cases of skin complaint could be acne rosacea in your clinic. Out of 10, out of 26 to 7 cases, at least 25% or 30% of the skin complaint will be acne rosacea. Okay. All the other medicines are there. We can give silesia, hydrocortisone, berberis acifolium, all that is there. But think about estrogen 30, sulfur iodine hydrocortisone. Rosacea, because there is sulfur iodine, because there is the hardness of the eruptions or acne. Okay, estrogen. Why estrogen is because usually there's a hormone involvement or PCOD or PCOS or hormonal change in the teens. That time when the acne rosacea comes, estrogen plays a bigger role. You can give Kalimur, you can give Baratamur, you can give iodine, you can give Jubilant Street. A lot of medicines are there. But in acne rosacea case with hormonal involvement, estrogen plays a bigger role. So we have to take that also. You can take the total case also, but at times we won't get too much of symptoms. I have got acne. I don't have anything. Menstrual issues are normal. Physicals. If you ask for the physicals, if you ask for the generals, mental, everything is okay. Okay, doctor. Whatever you ask, and they get irritated if you keep on digging it. In that cases, we have to stick to the external presentation and acute presentation and give the medicines. That time we have to use boric repertory. Uh, location, sensation, modalities, and concomitants. Location you get on the face, and the sensation or the look. This is the look, and the modalities known better by cold, better by this one, that one. At times you don't get it in these cases. So these are the things you can think about it. Okay, then acne simplex, and acne Asteria rubens. I'm not going into the detail with other common medicines we use. Every time we use the common medicines. That is very good. But these things also have to think about it. Asteria rubens. Asteria rubens is one of the best medicine if there is a breast involvement also. Another one, Asteria rubens, if you read it, uh, the patient will get too sensitive to slightest touch or slightest, if someone is tearing the paper or someone is just playing with the cloth, they get sensitive. Those kind of a skin, and there is a acne, Asteria rubens is very, very, very important. Again, Eugenia jumbos. Okay, Juglans syria and Juglans regia. Juglans regia is uh, one of the very effective medicines for the pimples. It also can be used for the axillary abscess. One of the specific medicine for abscess in the axillary region that can be used here as a doctrinal signature. Anywhere you get it, pustular eruption will be there. If you touch it, it may break. And it recurs. It keeps coming. Once you break it, then 3, 4 comes. So in that case, it puts a scar also. In that case, you can use Juglans Regia also. If the acne comes after the cosmetics, Bovista is one of the best medicine. That is a mostly specific medicine. The possessions, we say no location, possessions are more important. AF from, ailment from, cosmetics. Bovista is the best medicines. Alcoholics. Don't think that ladies doesn't get alcohol, doesn't drink alcohol. Ladies also drinks alcohol. Men also drinks alcohol. So after, if it is in the case of men, woman, anyone, if it is after alcoholism, ledampal is one of the best medicine and almost specific. If it is too inturated, carboanimalis, and if the rash or this one is after using the blades or anything of that sort, the causation factor, ailment from blade, ailment from using of the blade, that is carboanimalis. And if someone nymphomania cases or any other sexually, you don't get these cases very frequently, but 3, 4 cases or something of that sort. Statistically, if you take it, these cases are not less. Okay. In that cases, acid force. Think about acid force. Acid force is one of the best medicines for diabetes, hair falls. Okay, I have told you all this. This is also one of the best medicine, even if it is a pimples with the diabetes. If it's diabetes along with that, fine. If not, also you can think about it. Okay. Okay. Alopecia cases. Alopecia cases. For me, maximum is 7 to 8 medicines. Alopecia will be covered. If it is areata also, if it is totalis also, if it is normal thinning and normal fall off, these 3 few cases medicines can take care of the the alopecia. Yes, constitution is also very important, but at times if you don't get it, the constitution medicine, if you can't take up the cases in detail, these medicines will help you out. Okay, constitution medicine, I cannot tell you this constitution of that patient, that constitution of this patient. No, constitution medicine you have to find out by taking the cases. So taking cases, it might come out this way or that way. So whatever the medicine coming up, give it. And anti-miasmatic also important in the case of alopecia. I think I've shown you a lot of cases, lot of pictures for the last time. Selenium, you know what is this one. Selenium is one of the best medicine for the sexual weakness also. So if the hair becomes very thin and like that, okay, selenium is one of the best medicines. Syphilinum, again hair fall with uh, miasmatic lesion. So you take up the miasmatic. If the cause or if the cause is of destruction, then syphilinum. If the cause is a dandruff, that way you have to treat. If the cause is something else, check out for the causes. If the allopathic medicines or radiation medicines causes it, so think about Nexomica, think about X-ray, think about radium bromide. So those medicines can help you in regrowing of alopecia. It's one of the best medicines. Testis, again, male hormones. Why testis here? Okay. When we were in the schools, we have learned about in our local language the how a male should look. Male pattern of hair fall. Testosterone is produced there. So that is one of the common cause for hair fall also. Hereditary wise, testis is one of the best medicine. Thallium, when the hair fall is after COVID, after debilitating diseases, after viral fever, after any kind of diseases, thallium is one of the best medicine. Acid floor, again, syphilitic miasm, fluoric tendency, the flow, especially if the alopecia areata, nothing to be told about acid flow. Thyroidinum, again, one of the cause for hair fall. We have the medicine thyroidinum. Nothing much to talk about thyroidinum and thyroid complaint, even you can think about the obesity, you can think about the other complaints. Thyroidinum is one of the best medicine. One of the cause for thyroid complaint, one of the cause for hair fall. So thyroidinum 3x or thyroidinum 30 or thyroidinum 1m can be given depending on the sensitivity of the patient. And sensitivity, sensibility, potency, this all have to be judged by the doctor who's taking the case. Because I can give 100 theories about posology, but actually when the patient sees it, it is the best. And his experience. Because syphilinum, if you ask me syphilinum, how do you prescribe? I prescribe syphilinum 30 to 1m, 10m, depending on the history. If it's for a long time or if it's fallen faster, if it's a sensitive patient, then I go for syphilinum even 10m daily or weekly 1 dose, weekly 2 dose. So it depends upon the posology is there. Posology is better, safe is to start with low potency. But as your experience goes by and if your confidence goes by, you keep bombarding with the medicines 30, TDS, QDS, everything. You give medicines properly according to your confidence. But syphilinum 1m also doesn't make any other side effects. It gives you beautiful results. 30, yes, important, but I generally at this time of all after 25 years of experience, you have to experiment with the medicines. You have to experiment with the potency and come to a conclusion. This is better, that is better. This is how you have to give. This is how you have to think about changing the medicines. Okay. Barretta cup. Why Barretta cup? What is the point in Barretta cup? Barretta cup mind, Barretta cup brain, Barretta cup growth. Everything is dwarf. Everything is fallout. Everything becomes dwarf. Growth is impaired. All the stages of hair fall. It is changing. Everything is slow. Hair growth is slow. Okay. Hair fall slow. Hair growth slow. In that cases, Barretta cup and external hair oils. If you want it, you can give it. If you are not interested, this one. Because hair oil absorbs through the scalp skin. All the medicines in the skin absorbs it through the medicines absorb through the skin. So we have action through the skin also. Okay. And in diabetes carbuncle. Carbuncle is another one. Carbuncle is the medicine where you almost get it for the diabetes people. Lot of cases, even I had the carbuncles. And anthracinum, gunpowder, and scolopendra. Scolopendra is one of almost specific cases. You try this, read it from the books. Scolopendra, gunpowder, and anthracinum. Out of the statistics which I gave almost 15 to 20 or 30 cases, you get it in a year. So these three medicines come first line. So this is the what are called statistics medicines. Okay, and it acts 100% sure. Okay, cones. Let me check. Cones. I have a picture here. Cones. Are you seeing this case? Are you seeing these pictures? This is a cone. Okay, and see this. It's gone in a month. Okay. So most of the thing we speak with pictures. Homeopathy is 1 plus 1 is 2, not 3. Okay. So have confidence. Give these medicines. Cones. Acid picricum will be my first choice. That too 1 m. Okay. Andim crude. Silesia. Okay. These three medicines ranks first in this my list. These three medicines, and you can give cones and warts. One of the beautiful medicine is formic acid. Our medicine formic acid is one of the beautiful medicines for warts and cones also. Even formic acid, salicylic acid, you can do an external if it is needed. That is all up to you. But that is also gives you a much better results. Liver spots, overactive pigment cells, we sell no pigmentations. Okay, Argentine nitricum, tuja, brown spots all over the body. You don't have to see anything with you get that brown spots over the skin. Most of the people with brown spots, tuja, Argentine nitricum, we never think. Argentine nitricum as a deep acting medicine, deep acting use in melanin metabolism. Argentine nitricum can alter the melanin metabolism. It can give you pigmentations. It can correct your pigmentations. Okay. Tuberculinum, again tuberculum medicine and medorinum. This is again medorinum. Why? It has an effect on your genes. It has an effect on your cells. It has an effect on deep acting medicines. You can start with 30. You can start with 30. All this medicine you can start with 30. You can repeat the medicine if it's a 31. Okay. And I gave it in higher potencies also. But 30 is my favorite to start with. Okay. Again, bed sores. I'll show you a lot of pictures also little later. Bed sores. Again, arnica, acid floor, Merxol, muriatic acid. All the three I've told you. Silesia also. This one, calentula internally, echinacea internally. Okay. Bed sore. These are the medicines. And one more thing we can do it is if the patient has a bed sore, if the bed and the patient is rubbed with the calendula or echinacea oil, if you people have attended the what are called annual seminar, annual celebration of 5th year annual celebration, our MLA has been rubbed with Murivanna. Murivanna means it's an Ayurvedic product, but the alternative of Murivanna for us is Calendula echinacea hydrocotyle. You can at least rub it with that so that the patient is a bedridden can be prevented from bed sores. So prevention is first treatment. Once the bed sore comes, then you treat. We have our first duty as a physician is prevent the bed sores. Okay. So muriatic acid is one of the best medicine. Very sensitive skin. Skin becomes very sensitive there, or thick skin also, but it breaks and bed sore starts. Muriatic acid is one of the best medicine. If you can try it out, try it out. Comedones. Again, Eugenia jambolia, jambos, nightly, Eugenia jambos can be used for a nightly cramp in sole of the feet, not on the calf. If the cramp starts with from the sole, okay, that happens in the diabetic patients, diabetic neuropathy, cramps, potassium less, calcium, potassium, okay. So what are we supposed to do? Supplement potassium, Kali group, Kali 3X, Kali Phos, Kali Mure. We have a biochemic production or the single salted medicines. That I'm preparing one wellness and the medicines which we can use in this kind of natrium or potassium. Everything. When the sodium less, give our natrium 3x, 1x, 2x. It will improve. Same way, if you have a cramp, think about Eugenia jambolis. And Sampal. Sampal is another one medicine. Same thing, comedones. Okay. That is another beautiful medicine which we can bring out the waste of the comedones. Okay. Eczema. Eczema, sulfur, petroleum, all that medicines are there. But I'm telling you which I also give medicines. I also add on these medicines. Okay. Oleander, one of the best medicine for the skin and it's a chapped fingers. Oleander is one of the best medicine. Vinga minor, again, Vinga has typical skin blisters. It will be like almost like a pemphigus. Blisters are there. If there is a itching is more, Vinca can be used. Ethiops. Okay, Rus venerensis. In the Rustox group, if we can give, Rus venerensis is one of the beautiful medicine with severe, almost like a Rustox, but severe itching and severity is more in Rus venerensis. Clematis. Clematis can be of the itching in around the scrotum, clematis, fungal infections, uh, almost specific sexual area, clematis of the pubis, even in the scabies, pubis region, if there is a eruptions, even in the penis eruptions, clematis, one of the best medicine, manganum aceticum, that eczema around the fold, if the hand, the legs around the folds, wherever you have a fold, Manganum aceticum, you can think about it. Think about it other than come out of the box. Don't stick to the only those medicines which we have it, which we use. At times, keep changing it. Think about the out of the box. These medicines are beautiful. Once you start using it, it will be like your favorite medicines. Ethiops. Ethiops is another one of the thick, uh, thick skins. Itching will be there. Again, you can compare this with hydrocotyle, thyroidinum. We say gaja foot. Gaja foot means gaja thick skin. It will be like a elephant's thick skins. You can compare that. Okay. In that case, you have to find out whether it is a lupus, whether it is not lupus. Take out the case, read it, and check it out. Lupus has to be ruled out. Okay. Lupus, psoriasis has to be ruled out. Okay, if the psoriasis is there, management is different. Acute management as well as constitutional miasmatic approach has to be thought about it. Eczema behind ears, Chrysorubinum and Scrophularia. Scrophularia nodasa is one of the best medicine for any kind of tumor, even if it is a adenoids, if it is a fibrous tumor, any kind of a tumor. Scrophularia is one of the best medicine. Same Chrysorubinum is one of the best medicines. Chrysorubinum can almost specific like a eczema behind ears. Petroleum is there. Every other medicines, and I'm not going into that. I'm not even contradicting that. I'm not even telling you that don't give. You have to give these medicines, but think about these medicines also. Eczema of the joints, Ethuza, Mancinella, Natramur. Natramur is one of the best medicine. Ethuza, again, joints. If the folds, again, fold and joints. Difference is there. Fold, Manganum aceticum. If it is Natramur, Natramur is in the joints. Ethuza, if it is for the kids, Ethuza, Natramur, you can even think about the kids as well as elderly. But Ethuza comes mostly in the fungal diseases in the joints and all the wherever there's a joints, you get some at times eczemas. Again, Mancinella, eczema of the scalp. What all we think, mesarium, all that we think it. Think about the we think all these medicines. Along with that, selenium, we never ever think for the eczema of the scalp. Okay, it's a dry scalp, dry eruptions, pustules are less, itching is more. Okay, selenium, oleander, you know, no. There's a eczema around the edges of the hair. Wherever there is a edges around the this one, you get the eczemas. Okay, oleander, eczema after sea bath or salt water bath. Sea bath, natramur. See that what is the what are called similarity here? Natramur is a salt. Okay, same thing can be used for the sea bath aggravation of the eczemas. Okay, fissures, chaps, sarsaparilla, melandrinum, cystus, cervical gland, cystus is one of the best for the along with petroleum, graphitis, and all other medicines. Think about melandrinum fissures. It's a deep fissures. Might be painful, may not be painful, but deep fissures, leg cracks, cracks in the legs, cracks in the fingers, cracks anywhere, deep cracks, but may not be painful. Cistus canadensis. Again, Sarsaparilla is one of the, and this Sarsaparilla medicine goes to Dr. Jolie of Thrissur. She has given me the insight into it. To this medicine, Sarsaparilla is a herb which we all use it as a pickles and all that. So that medicine can be used to clear up the blood circulation and purify blood. Sarsaparilla is also used as a renal calculate medicines. You know, it's a red brick calculate, powder like calculates. Herpes of the fold, natramur, any fold, and if it's diagnosed as herpes, think natramur. Okay, herpes of the thigh, dolichos. Okay, dolichos is one of the specific. When you get a herpes of the thigh, think about HIV. Think about immunocompromised medicine, treatments. Rarely you get thighs herpes. You get thighs eruptions, back of buttock eruptions, but everything you get it. But thigh herpes, if it has comes with, then think about HIV as well as any kind of cancer treatment or immunotreatment or any immunosuppressant treatments. Okay, freckles, Kalibakar. Freckles is one of the best medicines. Kali carb and natramur. Again, Kali carb and natramur. Skin, Natramur is one of the best medicine for any skin complaints. Natramur comes in, if you take out any repertory, Natramur comes about in italics. You put eczema, Natramur comes in italics. You put anything, you quantify, you what are called qualify, you what are called eczema better by this, eczema better in the salt, eczema this, the specifics of eczema, whatever you put it in the repertory, there will be a medicine Natramur. So that much importance is there for the Natramur in skin complaints, be it freckles, be it anything else. Okay, leukoderma cases can be thought about with arsenical. I told you this one, depigmentation medicines. Medorinum is one of the best medicines, but all depacting constitution medicine is a must there. Along with the benefit, however you are managing it, you give it single medicines or anything of that sort, but constitution medicine has to be given. Acute stages, yes, we have to give medicines. Melanin is there one. Another one I've read it in Kopiga's medicine. Nylon is another medicine if there is a allergic to, and leukoderma or vitiligo developed after the allergic to nylon clothes. Okay. These medicines, constitution medicine, you have to add. You have to take case in detail. Even if you are thinking about acute, whatever the pathological prescription or whatever the way you prescribe, pathological prescription, organ prescription, miasmatic prescription, any kind of prescriptions you take, constitution medicine has to be given. That's my experience. Prickly heat rashes, bryonia, Hura is another one medicine, one of the best medicines. Hura, prickly heat medicines. We give Cantharis, Rustox, all that is there. But Hura, you try it out. You will not give other medicines. Bryonia is also another one of the best medicine for prickly heat. Bryonia, if you think, read boric. Bryonia is aggravation from sun. Sun had headache, bryonia comes in. Sun aggravation, bryonia comes in. Skin, sun aggravation, bryonia comes in. Rashes, small rashes, bryonia comes in. Cura, molluscum, bromium. Molluscum is also another medicine. Read, boric. Bromium is one of the best medicine if there is a prickly heat rashes. If it is a seashore, this one. Even if it is seashore, is bromium. One of the best medicines. Okay. Dermatitis exfoliativa. All snake groups are one of the best medicines. Why? Doctrine of signature. Lachesis, Naja, Crotalis, Horridus, and Vipera. All these medicines, all this Vipera is one of the best medicine for varicose ulcers. If there is exfoliation, skin exfoliations, if we get this exfoliation in the winter season, most of the palms and the skin exfoliate. That thing you can think about all snake groups. I don't have to tell you the specific. You go read, you can get all snake groups, almost same that comes in the group exfoliation. If it's prominent without itching, if there is a itching also, petroleum, all these medicines are. But snake group is one of the prominent ones. Acid sulfurosum, not sulfuricum. Acid sulfurosum, that is one of the best medicine for aphthous ulcers. Acid sulfurosum. Okay. Colchicum, we only give colchicum for gout. Okay. Colchicum for the gout and joint pains. Usually. Colchicum can be thought about in the splenic cases, even in the fatty livers, all that. But most of the cases we just forget this. Colchicum is almost like one of the best medicine for dermatitis exfoliata. Okay. If see whatever I'm telling you is, if you get details about the cases, take the case. You will get this. If you ask them, you get the disease, you get the details. But most of the cases, at least a few percentage, at least if you take 100 cases, 20 to 30 cases, you get only skin complaints. Yeah, what is your thermal? What food you drink? How you sleep? What is this one? Whether the sun aggravates, whether the winter aggravates. Sir, is everything is same. Winter also it comes, sun also it comes. So what are we going to take it? Ambithermal. So both extremes are also same. So you cannot take both extremes as a this one differentiating treatment, differentiating medicine, symptom to differentiate the medicines. At times we are not Honeyman's or single this one, we have to treat. Pruritus, morphinum is one of the best medicines. Clematis, again, radium bromide, rumex, specific after the once you take out your lungi or your pant or anything of the uncovered part, rumex. When you lift, when you this one, you get this. Okay. Pruritus, hips change, keep on changing with the hips. Cephysagria. So these are the location specific medicines. If you get this location, give this. There's only single medicines available in the rubric. When you get in the repertory, when you get a rubric with the single medicines, give importance to that. It may not be in italics, may not be in given it, but single medicine, if it's given in the repertory, that is most important. Pruritus aggravation after undressing, oleander, rumex, and menispermum. Okay, how to differentiate? Differentiation is experience. Okay, how much ever the medicines you give it, I'm talking about not with the you get all this. Okay, with my experience, one what I give it frequently, these medicines comes. Sulfur, petroleum, all skin complaints are there. Along with that, nowadays we get this. Psoriasis, again. Phosphorus, again, one of my favorite medicines. Phosphorus. Manganum aceticum, I told you earlier. Okay, so psoriasis needs a constitutional treatment most of the time, but we have to control the acute stages also. Oozing is there, wet psoriasis, wet things, dryness. We have to control acute phases. So these medicines will be helpful. Phosphorus, ulcers, I have told you, pioneer again, skin ulcers, syphilinum. I have told you, varicose ulcers, I've shown you a lot of cases. Urticaria, Bompix, antipyrine, chloralum, Triostem perfoliata. Urticaria from Triostem perfoliata is urticaria from gastric complaints. If there is some indigestion or anything, if there is a indigestion and the rashes come, nothing as what are the food it didn't digest, then think about Triostem. We think about first we think about Natramur, Pulsatla, all that. But Triostem is almost specific for urticaria from gastric complaints. Urticaria, you give urticaria urine, you give a lot of other medicines. Bompix, try this medicine. Bompix, antipyron, and chloralum. These three medicines you can blindly give it, even if it is I don't know whether I'm right or wrong, but these three medicines can be thought about it even in your dreams for urticaria. Okay. Warts again depends on the situation of the warts. Warts, natrum carb, maxulf, this comes, natrum carb and maxulf comes. Then depends on the situated on the hands before. Okay. Before is one of the best medicine if it is situated in the hand. Before and natramur, that is a two specific almost medicine comes up for the hand. Causticum is there, Dulcamara is there, all the other medicines are there. With due respect to all the common medicines we give it, with all the due respect, even I have used 101 times all these medicines. But these medicines are one of almost, you take out the boric and see what's situated on her hand. Verruca or what's in the boric skin last pages. Skin repertory last pages. It has given you all the situation. If it is situated on the nose, what medicine? If it is situated on the eyes, what medicine? If it's situated on the forehead, what medicine? If it is situated on genital, what medicines? So I don't have to explain too much on that. And that location of warts is more important. Head, medorinum. Oh, head, medorinum. You just listen to this and start giving the medicines frequently. And what happens is the warts on the head and these things, don't wait and watch. It doesn't make any difference to the warts. That's my experience. I'm not talking about the senior doctor. They might have treated them with one dose, but what are the medicines we give it? In my experience, at least tedious or curious for at least 1 or 2 weeks, because warts are viruses which are very slow. So to the this one is miasm is psychotic. So give it or higher potencies, low repetitions. Higher potencies, if you repeat 1 or 2 days, there's a virus can get into other places also easily. Next places it can come. Other places, hand, if it's one is here, it can spread it to other places. Okay, it was stagnant, it was one place for long time. Once we start bombarding with the medicines with the higher potencies, what happens is it goes into viruses, spreads to other places. Or virus, it was inactive, it becomes virulent. And if we touch it, and place this in another places, the small things can come. Okay, so these are the things you should think about it. And what hair fall. I don't know whether you can see this. This is a totalis, and see the difference. One, two, three, small ones coming up. Again, hair fall. See the difference. Okay, covered up completely. The patch of the vertex also covered up. Cones, I showed you. Okay, this is the cone I showed you. See the difference. Pharyngeal, I just want to show what is freckles. Freckles, I don't have pictures, but of the treatment, it's not easy for them to take. They don't allow, patients usually don't allow this ones. Okay, I think skin is over. Other things are COVID cases. With this, I can take it. I think skin complaints are over. The last thing is my experience. I've taken it from the COVID cases. Adenoids, all that. I think skin case is over. I'm going to stop this sharing. Hopefully, it was useful for everyone. Is there any time? You can ask me any question. 10 minutes are there. You can raise questions. Otherwise, I can go to other experiences also. But
Yes.
today's topic is skin. I wanted to just stop it there, or you wanted me to continue another 5 more minutes or 7 more minutes. I can continue with other experience.
Yes, definitely. We need a discussion on the same because a lot of people may have some doubt about these things. And excellent presentation once again from Dr. SADAT SAIT. He shows uh, it shows his immense knowledge in that area, and whatever he told here is absolutely from his mind, and rather than simply on textbook, he always speak only those things which he got result. Whether it there in a textbook or not, it doesn't matter. In which this he used to collect notes from all doctors, whether it be a junior or a senior, it doesn't matter. That kind of person, Dr. Sadat, and he tried to experience. He's tried to uh, test the same in his clinic itself, so that he gets the result or not. Actually, this is how a homeopathy can do. Once you get a clue about a particular disease medicine, then what you have to do is just try to read the text and make sure that the doctor told was there in the textbook, and how it works and when it works. As the case of Medornum, doctor told that you can blindly give the Medornum, but before that you have to read what is Medornum. That's what the conclusion here. Those who want to participate in discussion can raise your hand so that we can uh, have a discussion on the same. And
So I wanted to tell you something, sir. Any medicines, if I've told you, because this is from my experiences. So you give the medicine when you listen to one medicine from which we have not used it, take note of it and read. That is most important. So that it is there lodged in your head, so that you give medicines to the other patient, get your experience. That is first hand experience. One person told you, that is not blindly. You don't have to follow it blindly. You have to learn, you have to redo it, you have to rethink about your medicines and prescribe.
exactly, that's what whenever you get a clue from of a particular medicine, then what you have to do is just refer it first in the boric, and then you can refer it in our keynote, and then you can, if you want a better knowledge, you can go to the big books, as the so-called you can Meteorology by any of the doctor, whatever whom you like.
See, big books, what happens is there's a lot and vast information on that. So a beginner or someone who's not used to this medicines get confused.
Exactly, exactly.
Which one to take it? That is what you start from the Allen's keynote, boric, then go into the bigger ones. If the
But the
pathological prescription,
but the
Boningason is also good.
yes, the one with the most the latest trend in our junior doctors is that they may try for this rare medicine, and then they may read the text written by the recent the so-called faculties from the north. They when they try to in the similar way, they won't get the result, and they may thought that, oh, the homeopathy is a failure, like that. But actually, if a person study the polycosis in a good way and concentrate more on that, definitely we can treat in nearly 80 to 85% of cases with that alone. And only rare remedies are required in only 15% of cases, that too in different conditions also. If you look at the presentation here by Dr. Sadat, most of the medicines are polycus and only few remedies come along with that. So that is what the experience teaches. I'm inviting Dr. Dr. Shibi Varghese to say a few words on that, because she is also having a very good practice on that way. Dr. Shibi, you can open your video or without video, you can say make your comments here about the presentation and how one should move forward for uh, treating all these things. Please unmute yourself if you can. It's not bad.
TV from Kannur, right?
Yes. Yes.
One of the beautiful, one of the
Yes.
respected lady.
Then there was a question about the potency that was used for Medorinum by Dr. Divyasri. What was the potency you usually give to?
See, potency is 30 is safe to start with, but the problem with the potency is slow. 30 is it takes little time, and you have to repeat fast. Repetition you can do it with one arm also. That doesn't make it. But the problem is the action of 30 on a wart or any skin complaint is slow.
Yes,
So you have
exactly.
to. It takes time, and I am a person doesn't have any patience on that, and I want the result. If I give medicine and if someone is giving within 10 days, I need it in 5 days. So, and
Okay.
my experience has told with the talking to the senior doctors, a lot of doctors are there. Dr. Sujata from Thrissur, she gives only in 1 month and 10 months.
Because that much of confidence in her that
Confident she is. So
not only that
we
the
learn from our seniors.
there's a confidence from confidence what she got from experience.
Huh.
That's how the confidence build up. And once you get the confidence, you can directly go on to potency, what
Huh.
else may be. It doesn't matter.
So
It's not
safe is
potency. Even the 30th potency is not at all a low potency. It's a big one where 30 with the 10 with the 30 zeros on that. That is the power of 30th potency. And so I'm inviting Dr. Ambaresh sir to add something more, and you can add something more, as well as you can ask questions on the same.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. SADAT SAIT sir. Very nice, excellent session. Therapeutic. Describe the homeopathic medicine, skin trouble, corns, carbuncles, liver spot, rankles, tissue, clinical and truth remedy. Experience, clinical remedy. A lot of this the remedy therapeutic. This the Boric book and Ellen's keynote, Boga, etc. Clear describe, clear written in Boric and Bogar and Ellen's keynote. So very, very thanks, sir. Thank you.
Thank you, sir.
Thank you.
Anyway, thank you, Dr. Ambaresh sir and Dr. SADAT SAIT and those who attend the session. Tomorrow we will have a session from Dr. Ajini Maliekal, and Dr. will be talking about dream big. That is the third part will be tomorrow. Hope all of you will come up for the session, and you can join the session by exactly at 8:30 tomorrow evening. Thank you all. Thank you, Dr. Sadat. Do you want to say anything more? You can say.
No, sir. Anyone, anytime can call up. Anyone can talk. If there is any doubt, we are ready to clear
Yes,
it up.
the number was given in the in our flyers and posters, so that those who want to contact Professor Sadat can say in that.
Everywhere in social media.
Thank you all.
Thank you.
Good night. It's over to Dr. Mariamma John to moderate the Malayalam session.
നന്ദി ധനേഷ് ഡോക്ടറെ. എല്ലാവർക്കും നമസ്കാരം. IFPHന്റെ 1887 പ്രതിദിന സൂം വെബിനാറിലേക്ക് എല്ലാവരെയും സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. ഇന്ന് നമ്മുടെ ക്ലാസ് ആരംഭിക്കുന്നതിന് മുമ്പ് ഒരു നിമിഷം ഈശ്വര പ്രാർത്ഥന. നന്ദി. ഇന്ന് നമുക്ക് അതിഥിയായി എത്തുന്നത് ഡോക്ടർ MS പീതാംബരൻ സാറാണ്. റിട്ടയർഡ് CMO ഹോമിയോപ്പതി. 42 വർഷത്തിലധികം ചികിത്സാ പരിചയം. വൈറ്റമിൻ ഡിയും ഹോമിയോപ്പതിയും എന്ന വിഷയത്തിൽ ക്ലാസ് എടുക്കുന്നതിന് ഡോക്ടർ MS പീതാംബരൻ സാറിനെ ആദരപൂർവ്വം ഈ പ്ലാറ്റ്ഫോമിലേക്ക് സ്വാഗതം ചെയ്തുകൊള്ളുന്നു. സാറിന് ആരംഭിക്കാം.